The vaginal tissue is a very specific environment, and it requires estrogen in order to function properly. The pH of the vagina should be acidic at approximately 4.5, but without estrogen, the acidic environment of the vagina can no longer be maintained. When you can no longer maintain that proper environment, the skin inside the vagina becomes very thin and very fragile, so activities such as sexual activity become extremely painful. In addition, and especially to the patient who is not sexually active, estrogen is extremely important in order to promote the normal microbiome. In other words, the vagina has a very specific natural bacteria environment. Without the pH at 4.5, that microenvironment cannot sustain itself. That increases the risk for recurrent urinary tract infections. Without estrogen in the vagina and the surrounding tissue of the urethra and lower portion of the bladder, we also see an increased incidence of urgency and frequency of urination. However, there is treatment options that are extremely safe, and the results are very positive. Estrogen can be placed in the vagina in the form of creams or tablets, and that estrogen in the vagina treats the local tissue. So in other words, there's no systemic effect. Without absorption into the bloodstream, we now do not have risk associated with systemic estrogen. There is no increased risk of breast cancer, heart attacks, blood clots, or strokes. Vaginal estrogen is safe in breast cancer survivors. So if you are experiencing recurrent urinary tract infections or painful intercourse or difficulty emptying your bladder, please consider being evaluated for the need of vaginal estrogen.